Hi guys, Ariana here at the AAFE Training Center. I am going to walk you through a full PDO thread lift that I did on this beautiful patient and kind of talk through what I'm doing and talk to you guys about why I chose a thread lift. This patient is not new to threads whatsoever. I think this was her 7th thread treatment ever. She's definitely very big into threads and she has never had filler. So she really likes that collagen stimulation and the natural results that you get with threads. So I made my vectors and marked her when she was sitting up, of course. And here I am just taking my 18 gauge. I did numb that porthole that I'm going into with a little bit of Lido and Epi, just to give the patient max amount of comfort. And now I'm kind of making my tracks with the 18 gauge that I have here. And I take things very, very slow with thread lifts. I want to make sure the patient's comfortable. I want to make sure I know what I'm doing, where I am, and that I'm in the right depth, of course. So one thing I do want you guys to keep in mind is that the candidate for threads and education prior to the treatment itself is going to be so important. So making sure that your patients don't have any unrealistic expectations. For example, I notice a lot of patients come in wanting a thread lift, kind of expecting it to be a facelift, and it definitely is not. So educating the patient, expectations, post-care is so important. As you guys know, the post-care with threads and the bruising and swelling really can linger for a good amount of time. So just talking through that with your patient and educating them about what to expect. Of course, my education with this patient was a little bit different, having this being her 7th treatment and she performs these herself. She kind of knew what to expect post-care. She had taken a good amount of arnica tablets and preloaded on arnica a couple days prior just to help with some bruising and swelling. And she kind of was talking to me about what she wanted, her expectations, her goals. And she sounded like an absolute fantastic candidate for threads, just wanting the smallest amount of lift, good collagen stimulation, and just, as you guys can see too, she is very, very, very comfortable. And that's because she kind of knew what to expect going into this procedure. I find that the actual numbing portion is more uncomfortable than the thread lift itself. Ideally, the patients don't feel the threads because we numbed them properly with 2% lidocaine in the track, as you can see here. I opted for no Lido and Epi just because I didn't want to make kind of white blanching or have them kind of feel a little too funky with the epinephrine. So just 2% lidocaine here as I'm numbing the track. And this is kind of the pinch and burn feeling that can be very uncomfortable for patients. So I kind of warn them it's going to be a quick pinch and burn, and I can tap them, give them a vibrator, a stress ball, something to just kind of distract their nerves while I'm doing this to give them max amount of comfort. Now, one thing I want you guys to note, if you saw, I double checked where my antegonial notch facial artery is, and I did mark that up to make sure that I am avoiding it at all costs. Now, I don't have a risk of a vascular occlusion with threads, so that's less of a concern, but if I were to nick the facial artery, I might have a really bad bruise, some really intense swelling, and if I can opt to not do that, that would be the goal. So now I have her all numbed. I made my tracks, I numbed each track, and now I'm going in with the threads, which is the actual lift itself. I'm taking my time, making sure I'm at the right depth, twisting, advancing, and just keeping my hands in the right place to make sure that I basically make her comfortable, but also give her the best amount of lift. And the first one is done. It's super, super easy, but that was her first nasolabial fold thread. And then I'm going to go back in just a second, and I'm going to do that marionette thread, and then I'll do the jowl and one to the jawline. So this is technically a 3-vector lift with jawline. So 4 threads on this side of her face and 4 threads on the other. Now, when we get to the other side, you guys will see a little bit of some challenge I had, and I'm going to explain to you guys why I had a challenge on the other side of her face. when we get there, but keep that in mind. So here I am just kind of gliding down, no issues. I look great depth, but I keep just checking my depth, the location of the tip of my cannula, and just making sure that I'm in that right plane. And there is the second thread. So engaged beautifully, looks great. And there are my 2 threads. So you can already see a little lift, and I haven't fully engaged it and pulled back quite yet, which I'll do at the end, but you can see her talking to me, laughing. She's very comfortable. She has a very high pain tolerance on top of being numbed, but this is ideal. She was a perfect patient for doing a thread lift just because of how comfortable she was. She had experience with it, and she just took it like a champ. She was such a trooper and was communicating with me how she was feeling, how she was doing, which is amazing. She's perfect. So here I am going into that jowl one. I know normally it's easy to see the jowl, and she doesn't have one because she's been doing so many thread lifts, which is awesome. But she's being preventative when it comes to taking care of her skin and her face. And I think you guys would be shocked to know her age. She is actually 46 years old, and she looks like she's 26. So that can really show you the power of threads and what they can really do. I mean, look at that lift. And I haven't even pulled and engaged yet. So totally normal to be bruised and swollen. I don't want to freak you guys out with that. She definitely is swollen. Keep in mind that I had put 2% lidocaine in there as well, though. So now I am just pulling those threads, engaging them as much as possible before I trim and kind of smooth everything out. So I'm just going to trim them, obviously, to make sure that we don't have any threads kind of lingering in her face as she goes home. So I cut them pretty close to the skin, of course, being very careful as to where I am. I don't want to cut skin, of course, but just trimming, and then you guys will see I'll put a bandage on and also smooth everything out because I don't love for my patients to go home with any threads puckering, anything like that. So here I have my arnica. And I'm just going to work those threads. This is super weird for the patient because they can hear popping. Now, this patient, having done this before and loving threads so much, was totally okay with it. And she actually said that she enjoyed the sound. But for a first-time thread lift patient, it can be a very kind of intimidating sound. And they don't love it. So keep that in mind to kind of warn your patient. That is totally normal to be expected. It kind of sounds like popping, not necessarily like popcorn, but almost like bubble wrap. So here I am going to the jawline and creating a vector there. I did already numb that porthole, so I'm just going in with that 18 gauge. And I'm going to numb the track, of course, just to make her extra comfortable. I will say, though, the numbing on the 3 vectors above really makes the jawline more comfortable for patients, just because they already are numb and the spread of that lidocaine really helps. So that's not to say that the jawline numbing is unnecessary, but just keep that in mind. It is a little bit easier than the first 3 vectors. The first one's going to be the most uncomfortable for them because they have no numbing. You know, it's in a tender area. And just being close to the mouth can be a super sensitive area as well. So just checking my depth, same thing here. And taking my time, twisting and advancing, and using both hands to kind of get where I want to be in the tissue is very important. So it's very hard to ever do a thread lift with just one hand. So keep that in mind. My left hand is my best friend when doing a thread lift. And it's so necessary for getting the perfect lift, the perfect placement, the perfect depth. You really have to use both hands together. So you guys saw this already, but just pulling the skin taut and really engaging that thread. And then I will cut the thread itself. And again, use arnica and blend that tissue. Again, the noises can be weird. But satisfying, and it's satisfying as an injector performing the treatment. I just love the lift that it gets. I mean, she looks so fabulous. If I were to be too superficial on any of these lifts, I will say heat is going to be your best friend to kind of break down that thread quicker, which is something that we teach in our PDO 1 and 2 courses. So if you do have any questions or any desire to learn this, I definitely highly recommend taking our course, and we will walk you through everything, pre-care, post-care, etc.